4 million cases, 155,000 deaths later. This president does not see the coronavirus pandemic as his problem to fix. But if he did, one of the things he would probably read first is this piece in Atlantic Magazine. It's called How the Pandemic Defeated America. A Virus Has Brought the World's Most Powerful Country to Its Knees. Written by Ed Yong, science writer at The Atlantic. Ed Yong joins us now. Ed, it's an incredible piece. I want to get right to it and read you some pieces. And if I left anything out that you want to talk about, please jump in and point me toward them. But this was a gut punch. You write this: the coronavirus found, exploited, and widened every inequity that the U.S. had to offer. Far from being a great equalizer, the pandemic fell unevenly upon the U.S., taking advantage of injustices that have been brewing throughout the nation's history. And let me read one more before I turn this over to you. You also write, as of early July, 1 in every 1,450 Black Americans had died from COVID, a rate more than twice that of white Americans. Latinos were 3 times as likely to be infected as white people.
I mean, the statistics are so stark. And I think the sad thing about this is that it was entirely predictable. Like, of course this would happen. America has such long-standing health inequities that date back to after the end of the Civil War and ever since, when healthcare has been deliberately pushed away from Black communities, where healthcare has been apportioned more according to the logic of Jim Crow than of Hippocrates. And as a result, Black people suffer worse health outcomes across the board. So it is no surprise at all that should a pandemic happen to strike a country like this, that they would suffer a disproportionate brunt of it. Same for brown people. The same goes for disabled and poor and elderly communities. I mean, just take poverty. So many of the actions that we have recommended to keep ourselves safe are out of the question for people who work low-wage, hourly jobs without sick pay. You know, how do you expect someone who needs to put money on their family's table to stay at home all the time instead of going to work, working in those essential jobs that the rest of us are dependent on? So again, much of what has transpired in this pandemic... Sorry, go on.
No, I just wanted to pull the thread further with you on the same point. The cycle we seem to be in now is that, as you said, the statistics are a gut punch. Reading it on paper and reading it out loud is sickening. But where we're heading now with the economic calamity is that health insurance is tied to employment in this country. And with people literally pouring off the employment rolls, it's about to get worse before it gets better.
It's about to get much worse, absolutely. And I think it really highlights the weakness of having a system like this, which is just singular in the world, where you tie a person's access to healthcare to their employment. You know, this is not the first time people have been talking about this as a problem, but I think the pandemic truly highlights these compounding crises where you have a government that doesn't take enough action. You have a virus that then is allowed to wreak havoc around a country that is already riddled with inequalities, with all kinds of other vulnerabilities. People get sick. They fall away from their jobs, from their normal lives. And now they don't have access to healthcare at a time when they need it the most. And I think this spiral was also predictable, as with much else of this pandemic. It really has found, exploited, and widened every weakness that the United States had to offer. And it turned out the country had plenty to offer.
You also report out how in Washington, the White House and the federal officials did everything wrong. You write this: in practice, this is about travel bans, hurting, not helping. You write, in practice, travel bans are woefully inefficient at restricting either travel or viruses. They prompt people to seek indirect routes via third-party countries or to deliberately hide their symptoms. They're often porous. Trump's included numerous exceptions and allowed tens of thousands of people to enter from China. Ironically, Travel bans, create travel. When Trump later announced a ban on flights from continental Europe, a surge of travelers packed America's airports in a rush to beat the incoming restrictions. So even when we tried, we failed.
It's the wrong measure. And, I keep on saying that this was predictable, but someone whose first instinct is to build a wall, who rode into power on this tide of xenophobia, was always going to reach for border control as their first option. And I admit that it is very intuitive and that it seems promising, but for all the reasons you read out, they're very difficult to enforce. They might delay the spread of a pandemic for a few days, maybe weeks at best, but they're not going to stop it. To stop it, you need to get testing ready. You need to shore up your hospitals. You need to get public health strong. And the risk of putting travel bans in as your primary means of defense is you forget about doing all the other stuff because you think you are secure. And that is clearly what happened to the United States this year. Someone who can't think of anything else other than to build walls and erect barriers between people reached for that and did nothing else.